Good morning. Good morning. Welcome, welcome, welcome. It is Saturday. I cannot believe it's another Saturday. Today is June the 19th, and it is bright and early on a Saturday morning here in sunny, very hot South Carolina. When I opened my chickens this morning, it kind of felt like it was going to be 110 degrees outside today. So I am so happy to be here, and I am looking forward to this time with everybody. My name is Lizette, and we will get into the introduction stuff here in a second. Welcome to the Baffled Brain, Demystifying Dementia. Today is June the 19th, 2021. And this is Welcome to the Baffled Brain, Demystifying Dementia, the weekly hour-long Facebook Live that will teach you everything you need to know about dementia and what to do next. So let me practice that again, because I don't think there's anybody out there yet. My comments have been squirrely the last little bit. So welcome to the Baffled Brain, Demystifying Dementia, the weekly hour-long Facebook Live that will teach you everything you need to know about dementia and what to do next. Today is June the 19th, 2021, and this is episode 29, and I'm your host, Lizette Cloete from Think Different Dementia, where we believe everyone deserves reliable dementia education. Dementia is complex. Let's make it simple. So today I thought to start with, I would just talk about something that happened that we were talking about in my Facebook group called Think Different Dementia while I wait for a few people to hop on. I have been having trouble with my comments and I don't know why. So I'm going to pull up my phone. It's a little laggy, but it'll work. So I'm going to pull up my phone so that I can see if anybody puts a comment out there. Let us see. One comment. Let's see. Hey, Lori. Good morning. You're bright and early. I love it that you joined me. So on Thursday nights, I moved it to Thursday because it's a little easier for me on a Thursday evening. On a Thursday night, I have a different program in my own private Facebook group called Think Different Dementia, where we are actually just concentrating on education. This program is more to be interactive with you guys, and I want you to ask me specific questions. I do answer questions in the other group, but if you are interested, this past week we talked about transitioning care. I had somebody who asked about transitioning from independent living to assisted living to memory care to skilled nursing facility, and she was in the process of needing to move her mom to memory care in her own studio apartment, and she wanted some insights into what to do and what to look for. So if you're interested in that program, in the comments I'm going to put later on today, in the comments I will put the link to the group. It's called Think Different Dementia, and I would invite you to go watch that because it's pretty interesting. In that group we've also talked about things like guardianship and some other topics like urinary tract infections, a lot more educational based rather than question answer based. So I hope you join me for that. If you guys have questions today, I invite you to ask me questions. I'm here to actually answer the questions on this live stream. So I'm here for your questions, even though I have a list of questions that I am able to pull from, because sometimes it takes a little bit of time for people to actually ask a question. So this morning I'm going to start with a question from Sylvia. Sylvia said or asked, have I talked about bed sores or pressure sores? She said her dad's CNA told her that he has a small sore under his rib, and they're treating it with a cream. And so she was looking for information on bed sores. So I find it helpful to always start with a definition, right? What is a pressure sore? So a pressure sore is literally just that. It is pressure, and it can be from the outside in or from the inside out. So a pressure sore occurs any place where there are bony prominences. This is a good spot to show. Like on your wrist, you got a big fat bone, right? On your elbow, on your bottom, on your sacrum, any place on your body where there is a bony prominence or a bony part that you can have pressure from literally any place. So it can be from your arm resting on a bed where there's pressure in the from the bone on the inside because of the pressure on the bed, and so it will degrade there. So typically people, if you think about it, if you think about yourself, right, if you're uncomfortable sitting in a chair, you go for a long car ride, right, and you're uncomfortable sitting in the chair, you squirm. You squirm around, you move your butt around trying to get more comfortable, right? That is your body telling you to move because you're feeling pressure somewhere. So people, when they are if they have a disease process, think spinal cord injury or something like that, and they cannot move and they cannot feel that pressure, they develop bed sores, they develop pressure ulcers. Now, people with dementia, if they are at the end stage of their life, if they're at the end stage of their dementia, they can also develop pressure sores. And pressure sores in people with dementia often occur when they are laying in bed. It's not the only place that it can happen, but it's more often that they can when they're lying in bed. So it can happen on the base of the spine, right there where your butt crease meets is called the sacrum. So if you're laying on your sacrum, right there is where people tend to get pressure ulcers. And it can happen any place where there's a bony prominence. So back to Sylvia's question about bed sores or pressure ulcers, where she said her dad's CNA says that he has a small sore under her rib that they're treating with the cream, or under his rib that they're treating with a cream. And now I'm confused. It could be her dad said her mom has a small sore under her rib that they're treating with a cream. My guess would be, Miss Sylvia, and I will tag you in this later on, my guess, Sylvia, is that your mom might not actually have a pressure ulcer. It may just be a sore. Now, tends to happen if it is a female, and specifically ladies that are a little bit more buxom, who have larger breast tissue. Their breast tissue can lay on top of other skin, and that can cause a sore under the breasts, and that would be on the ribs. So I'm thinking, Miss Sylvia, that that's what's occurring. It could be a yeast infection, skin on skin. If you leave skin on skin with anybody, you will tend to get a yeast infection in that space. So the fact that they're treating it with the cream leads me to conclude, Sylvia, that this is probably what is happening, and that it's not necessarily a bed sore. But that is where we started the conversation. So, if you're interested in learning more about bed sores, you can go back into the earlier part of this live stream later on when it's there. So that is Miss Sylvia's questions. Does anybody else have a question? Anybody that's on live? I see Lori's there. I know Pietra's there. I don't know who else is out here. But I would love for you guys to actually ask me questions in the live, because that's what I'm here for. This hour is for you guys to ask me questions, because I know that dementia is complex, but we can make it simple. Let's make it simple. So the next question I have, there's a comment out there. I'm having issues with my comments, so I'm using my phone. So forgive me, because I got to refresh it every time. Let's see. Glenn, have a good day. I can't say Galena. Have a good day. Thank you. Well, I hope if you have any questions, Miss Galena or Legaspi, that's a beautiful name. If you have any questions, please throw them out in the comments. I love to answer questions. So here is a question by Terry Burke. Terry said, "Hi everybody, this is my first time posting about my loved one, who's my mom, who lives in a nursing facility and has been there for about 6 years in Georgia. I live in North Carolina now and I want to bring her here to live with me. I'm very fortunate to have my wife encouraging me to stay home and bring her here to our home. Any advice would be encouraged for this move and how to get things started with a transfer from state to state. Thank you in advance." Terry, I am so grateful that you posted in this group. This group is a very great group for supporting people. Thank you so much for posting. And first of all, I am so very sorry that your mom has been in a skilled nursing facility for 6 years. I know and I understand how difficult a decision that is when we have to place somebody in a nursing home. Just because you've placed her in a nursing home doesn't mean that you don't love her. It means to me that you have always had her best interest at heart. And so I know the decision to think about bringing her back home is also with her best interest at heart. And I know, Terry, that this is a difficult process, but it doesn't have to be. It can be made very easy. So let's talk about how we do this. So bringing somebody home, so we have a few things going on. We have bringing somebody home from a nursing home, and we have bringing them across state lines, and we have all of the steps that go with that. So to make it simple, Terry, what I'm going to suggest is the first thing that you need to do is really be in significant contact with the nursing home social workers. You have to understand everybody comes from a worldview perspective, right? Everybody has a particular worldview. Everybody is looking at being able to keep their own facilities full. So the social workers are not necessarily going to be super gung-ho in necessarily helping you move your mom from a facility to a different state, right? So when I had to have surgery years ago, the surgeon says have surgery. I have Barrett's esophagus, right? Barrett's esophagus can be a precursor to cancer, and it can be caused by a hiatal hernia. I had a hiatal hernia, and so I went to the surgeon. The surgeon says fix it. The gastroenterologist says keep it that way. And just have an EGD every year, right? So I have two conflicting people. They're each coming from their own worldview perspective. So if you think about, Terry, if you think about the nursing home, right? The nursing home wants to keep their beds full. The nursing home is not necessarily going to want to, they will, but you may have to convince them. They're not necessarily going to want to move somebody out because then they have to fill a bed. Your mom's been there 6 years. So the first place I would start is with making sure that you get that you talk to the social workers. The second step, I believe, is that you need to make sure that you have a physician on the other side willing to accept your mom as a patient. The third step that I would do, Terry, is I would be finding a medical home health company, and go talk to them and say, I know my mom's not here yet, but I am getting ready to bring my mom across state lines, and when I bring her here, I want her to be admitted to your agency. The reason I say a medical home health agency is because typically medical home health agencies, Terry, have a social worker. And so I want a social worker on the Florida side. I'm sorry, Georgia side, and I want a social worker in North Carolina. And then you want to have those social workers start to talk to one another. If it's not possible to do it because she's not been admitted to the home health agency, that social worker will hopefully be able to help you figure out, the steps that you need to take in order to do that. You have to have a physician. In order to have a physician in order for her to be admitted to home health on the other end, there needs to be a physician that will accept her care. So you want to have the social workers on the one side be very active in trying to help you bring her to across state lines. The thing that people don't always think about is that, she likely has, and I don't know your particular circumstances, Terry, so forgive me if I'm misspeaking, but she likely has Medicaid, or if she has Medicaid in Georgia, then she's not necessarily immediately going to qualify for Medicaid in North Carolina. So you have to be fairly confident that for the period of time that you bring your mom home, that you have your systems in place to support you. So 3 easy steps to start with, right? Talk to the facility in Georgia, tell them what you're planning on doing, find a physician in North Carolina that is willing to accept your mom, and then you have to be able to look for a medical home health company that has a social worker that can perhaps help you with that. If you need more help with this, Terry, I do consultation, and I have successfully helped other people bring people home from a nursing home and take care of them at home, and I'm more than happy to help set up a more formal consultation model if that is something that you need help with. So I would love to help you with this, so just let me know if you need help. You can reach out to me at Lizette Cloete OT. And I see that Miss Lori has a question. Lori says, how quickly do bed sores, yeast, diaper rash, etc. develop? How quickly does infection set in? So Lori, a pressure ulcer can happen very quickly, especially in people who have very limited tissue, right? So when an individual is getting to the end stages of their dementia journey, their blood supply starts to be more limited. They start to have less fatty tissue. It can happen overnight, especially if the person isn't being moved adequately. A person who is not able to move themselves, Lori, they need to be repositioned every 2 hours. And literally any space that there is a bony prominence, it can happen anywhere. I have seen pressure ulcers on wrists. I've seen pressure ulcers on elbows. I have seen pressure ulcers on the back of people's heads. Any place where there is a bony prominence that's not being moved, a pressure sore can develop. So it can happen overnight. Now the other question, where you said yeast infections, diaper rash, everything can happen very, very quickly. They can happen quickly, especially when people are hot and sweaty, or wet, if there's a lot of moisture in between. So I would, encourage you to make sure that they are being, that your husband's being moved frequently, every 2 hours. And so some other things to look for are, if there's a red area, if you push it and it stays white, that's a sign that a ulcer might be occurring. So pressure ulcers happen overnight. I have seen it time and time before. So I hope that was helpful, Miss Lori. So here's the next question. This one was a little longer, so if any of you guys have questions, please throw them out there. I'm a little on a lag. And Moira, happy birthday to us. Both Moira and I are September babies. She was telling, she said something about it earlier. Ooh, I need to get that happen. That was bad. So anyhow, I just put my phone on because for some reason my comments aren't showing up on my computer here. So the next question was from Keelan. Keelan said, I love this group and your messages. It gives me strength. Keelan, I am so glad you are getting what you need from this group. That is what this group is here for. I'm currently caring for my mom who has been diagnosed with dementia. I know how hard that is. I am so sorry. She has lived with me and my young family, so Keelan's 41, her husband, a 10-year-old and a 7-year-old for the last 6 months. I'm running low and feeling caregiver burnout that many talk about. While this is happening, my husband and I have been teaching online. My kids are stressed and crying daily. I'm exhausted. Keelan, that's a tough place. Tough place to be. I know it is extremely hard to take care of somebody 24 hours a day, 7 days a week, and I'm glad that you are getting the support from this group. So her question was the following. My brother and I are looking into long-term care homes for her. We have cleaned her place and are ready to put it up for sale. My mom knows, or she thinks that her mom knows, it's not safe for her to return to her home. Do I bring her home to say goodbye? I am so torn. She says to me, my house, Keelan's house, is her home. I feel like we've made so much progress to get her to this point, and that if I take her to her house, she will be taking 10 steps back. However, I feel like I owe it to her to take her there. I am so torn. This disease is heartbreaking. So Keelan, I am so glad you're here. I invite you to my Facebook group called Think Different Dementia. Ironically, this past Thursday night where I did my program, we were talking about transitioning from one level of care to another. So from independent living to an assisted living, to a memory care, or to a nursing home. So I invite you to that group to go watch the hour-long program that I did there on how to transition somebody from one place to another. So what I want to talk about today regarding this is I am so grateful, Keelan, that you identified that it is necessary for you to consider a different level of care for your mom. I know that it is a very difficult decision for people to make, and there is nothing wrong with it. You did nothing wrong. You are not guilty of doing anything wrong. So I want to applaud you for making the best decision for you and your family. No one else can make that decision. Nobody has the right to tell you it's the wrong decision. If you are at 6 months already experiencing significant burnout, you have a young family, you have a husband, you have children, you are making the right decision for you and your family, and thank you for doing that for your mom. Regarding what you said about your mom's home, this is what I would say to you. Just remember, and I don't know what level I don't know what level of dementia your mom is at. There are pros and cons to every decision. If your mom is not asking to go home, I would not necessarily take her there. I would say that if your mom is comfortable and confident in your ability to care for her and she is not asking, don't open that Pandora's box. I would likely just recommend to you that you be loving and factual about the move from the one place to the other, and that if she says that your home is her home, remember, you can bring her back out to visit your home. But if her brain has transitioned on and she's not necessarily asking about the stuff in the past, I would not take her back to her home. I think that I don't think that you owe it to her. I think you owe it to her to make the best decisions for her with the information that you have at hand. So if you want to watch that other video, I invite you to Think Different Dementia, my Facebook group, where we do another Facebook Live live once a week to talk about different topics. This past week it happened to be transitioning care. So thank you, Keelan, for this question. I thank you for being here today. So does anybody out here have any questions? While I'm waiting to see if anybody is going to ask me any specific questions out here today on the viewers that are on live, I'm going to invite you. There are three primary ways to get a hold of me. You can join my group Think Different Dementia, where once a week on a Thursday night I do a Facebook Live that is more topical. I ask people what they want me to speak on, and then I kind of expound on that. The second thing that second way you can get a hold of me is you can message me at Lizette Cloete OT, and I do answer questions to people there. And the third way you can connect with me is my YouTube channel called Think Different Dementia, where all of these videos are uploaded once a week, and if you miss it, you can go look there. So if you subscribe to that YouTube channel, you are welcome to go look at the older videos. There are 29 episodes now. I'm super excited about that. So the next one's a little longer. This one was from Becca. I am not ready to put my mom in a nursing home or any facility. We have added to our home a huge room for her with a walk-in closet, a complete bathroom, a small refrigerator. Nothing to cook on. I didn't need to worry about that. I totally agree. Anyway, every morning at about 3 a.m., she calls me very confused, not knowing where she is. When I tell her it's her bedroom, she will get angry and say, no, it's not. So I get out of bed and walk to her room. I have COPD pretty badly, and my oxygen line won't go that far. I have another setup in her room, so I'm able to tend to her. It is becoming a complete nightmare, and none of us are getting a good night's sleep. I'm so sorry about that. That's really hard. Night before last, it was 3 different phone calls. I might add, when I go to her room, she has changed from her pajamas to her normal street clothes. She has her purse over her shoulder, and she has her mask on. She claims she is scared. She doesn't get the fact that her bedroom was built on, and once even referenced that we kind of just dumped her in this little house, and wants to know if I drove over. It is very painful. And then she said, I'm not sure I can go the distance. I swore no nursing home, but as I said, my COPD is bad and I have lung cancer. First of all, Becca, I'm so sorry about the COPD and the lung cancer. That is very, very hard. I don't care so much about my own health, which is a whole separate conversation. I'm just limited in what I can do. We go nowhere really, because since all of this has been started, I have been stricken with terrible anxiety and panic attacks. I finally admitted to myself that I'm depressed, so I have had my doctor put me on medication, and it is helping. And I'm so glad that you're taking care of yourself. So, Becca, the first thing that I wanted to say is thank you for sharing this. This is a very difficult situation, and I know that it must be very hard for you. The first thing, and I'm kind of going to go about this in a little bit of a backwards way. The first thing that I want to say, Becca, and to anybody who is taking care of anybody at home, we have a tendency when we are a caregiver to flip-flop things. There is a hierarchy of needs when we are tending to other people. And so if you guys remember, everybody knows about Maslow's hierarchy of needs, right? The first one's food, shelter, clothing. Well, that works the same thing with dementia. There is a hierarchy of needs with dementia. When we are a caregiver, okay? So the hierarchy of needs works this way. The very, very base of the pyramid, the very most important thing is the household. The household has to function first. You as the care provider need to be able to get food on the table. You need to be able to get the laundry done. You need to be able to get the groceries taken care of. You need to pay the bills. You need to be able to go and get your medication. You need to be able to do all of those things have to happen first. You need to be able to go to your own doctor's appointments, make your mom's doctor's appointments. All of those things have to occur first. So that's the very base of the pyramid. The next priority is you, Becca. You are the next priority. You have to take care of yourself first. You cannot not take care of your own health needs before you take care of your mom's needs. You have to take care of yourself first. And what I mean by that is you need to be able to sleep. You need to be able to go to your doctor's appointments. You need to take care of your own health first. So if you think about it, if you're on an airplane, and most of us have flown. Not everybody has flown, but most of us have flown at some point or another, right? What happens? What does the stewardess or the flight attendant or whatever the word is these days, what do they tell you when they do the safety check at the beginning, right? They say if the airplane starts to go down and the oxygen drops out of the ceiling, the very first thing you have to do is put it on yourself if you are flying with somebody that you are taking care of. So why? Because dead is dead, right? So if you pass out because of lack of oxygen, then the person you're taking care of is also going to pass out and die. Well, everybody, we're all going to die. But the point is food, shelter, clothing, household first. Then you, Miss Becca, you have to be able to take care of your own healthcare needs first, and then you take care of your mom. So back to the question that some of the other statements that you had. You've built a place on your house for your mom with a huge walk-in closet and a bathroom, and that is wonderful. I'm so glad you have the space to take care of your mom. Now, to talk about back to what we were talking about earlier in this program. So if you missed it, and then the other part of it is, it seems like the topic this week is transitioning care, right? So you have transitioned your mom from one place she was living to another place that she is now living, which is now in your own home. The first thing that I want you to understand is that it takes about 3 to 4 weeks for people's brains to catch up with the transition. So it's going to take your mom several weeks before she gets into a new and familiar routine at your home. Okay? So I don't remember when I copied this question. My first thing would be, I think it's been a few weeks, is have things improved over time. You got to give it 3 to 4 weeks to see if it's going to improve. And so hopefully that has happened. And then the other thing is, reasoning with people with dementia is not helpful. It doesn't help telling her, remember, Mom, we've moved you from your house to my house. Now you're living at my house. That's not going to help her. So you just want to kind of give her some time and see if she adjusts. If you are interested in watching the hour-long program that I did on transitioning care, please join my Facebook group called Think Different Dementia and go watch that hour-long program, and then message me if you need to, if you have any other questions. And thank you for asking. Does anybody out here have any questions today? Everybody's very quiet. It's a very quiet Saturday. So in between my questions, I will just give you the 3 primary ways you can get a hold of me. You can message me at Lizette Cloete OT. You can join Think Different Dementia, my Facebook group, or you can subscribe to my YouTube channel at Think Different Dementia. I see a couple more people have hopped on live. This is Think Different Dementia, this is the Baffled Brain, Demystifying Dementia, and I'm asking for you guys to ask me questions. So if any of you guys that have hopped on right now have any particular questions for me, please ask them. I love answering questions from the viewers. This is why I'm here. I have my handy dandy notebook over here, handy dandy notebook. I have my handy dandy cheat sheet to ask a couple of extra questions, that I have some extra questions. Everybody's very quiet. And so here is another question. So my mom has vascular dementia. And this is from Diane. She is extremely anxious and never wants to be left alone for a minute. Occasionally, she will have her moments where she thinks that she's been captured. How do I handle this? Well, I am so sorry, Miss Diane. I know how hard it is. Vascular dementia is pretty difficult. Let's talk about what vascular dementia is real quick. So, what is vascular dementia? Vascular dementia is when people have some sort of a cardiovascular issue that means that they're not getting enough either oxygen supplied to their brain, or the arteries and the vascular system in the brain is constricting. And so it can be due to a lot of different reasons. Like my mom has vascular dementia. She had a stroke in her early 40s, and her vascular dementia is because of multiple TIAs over the past several years. And so they can have a lot of different signs and symptoms, and can be very challenging sometimes to manage. So most people with dementia over time can have anxiety. And what you have described here, Diane, is not at all uncommon. That you are her safety blanket, that she does not want to be left alone for a minute. You are her familiar person. She feels safe and comfortable with you, and anxiety can be very difficult to manage. So let's talk about anxiety just for a second, right? So any behavior a person with dementia is exhibiting or showing is usually a way for them to try to communicate something to you. And the communication is it's our job to figure it out. They cannot necessarily tell us anymore. A person with dementia cannot necessarily tell us what's making me anxious, right? And it can be literally anything. But there are typically three things that we're looking for. Four if you want to get really complicated. There are three primary spheres that influence people with dementia. One is themselves, right? So whatever's going on in them, do they have an infection? Are they cold? Are they hungry? Are they tired? Whatever. One is the caregiver. Or is the caregiver extremely stressed, or the way they are communicating with you? There are lots of factors that come with the caregiver. And then the third one, the third sphere of influence, is the environment. So if you think about this as a Venn diagram, and I should actually make one of these because I do this almost every week. If you think about this as a Venn diagram, we have the person with dementia, we have the caregiver, and we have the environment. Whoops, I can't write. Environment, and I can't write. And when everything is going well, there's a happy space in the middle, right? I don't know if you guys can see that. So when everything is going well, the black spot in the middle is where everything is going well and mom is happy. So when all of those factors are in a good place, we have a happy camper, right? So when somebody is extremely anxious because of their dementia, I want you to start to play dementia detective. I want you to look and see when she's not anxious, what do the factors look like? Are there certain times of day when she's not anxious? Are there certain things going on in the house that make her less anxious? Are there, when she is more anxious, are there certain things going on that make her more anxious? Are there certain people there? Is there a lot of noise? What are the factors that are contributing to her being anxious? And then you want to write everything down. You want to diarize it. It is very, very important because it can be such a small thing, and you want to know what are things that may or may not be triggering it. And occasionally you said that she has her moments when she thinks that she's been captured. So I would wonder, Diane, and I will try to message you this later on, but I would wonder when she feels like she's being captured, if that's not a separate problem from anxiety. And so, I want you to think about, is that something different? Is she hallucinating? Is there something else going on? So thank you for that question, Miss Diane, and I'm so super glad that you're here. I see Miss Cheryl is has a question here, and let me grab my eyes because Lizette is getting old and blind and cannot see. So my mom is moving to memory care mainly due to the need for more cues and reminders. She wants to travel. Should we just take can't English. Should we just take day trips so we see how she does? What should we consider? Great question, Cheryl. Thank you so much for that question, and thank you for giving me the topic for our little hour-long thing in Think Different Dementia earlier this week. So, mom moving. Remember what we talked about, right? Transitioning from one place to another. So, when a person is going from one place to another, because we use our environment to cue ourselves. If she wants to travel, I would probably just do day trips, because every single time she goes and sleeps overnight, it may make things worse. She may get more confused. It can take up to 3 to 4 weeks for her head to catch up with her. So let me tell you a story. I have had multiple patients over the years that unfortunately did not take my recommendation as an occupational therapist. They have a parent, and the two siblings are trying to take care of mom, and they move her literally every week from one house to another and back and forth. And they didn't understand why she was constantly confused and that things were getting worse. So I would recommend, if you do want to travel with your mom, I would definitely only start with day trips, and I would start with day trips that are pretty short, and see how it goes. Some things that you should consider is, if your mom is incontinent, how are you going to manage incontinence on the trip? If your mom is, if she totally wigs out on you in the trip, what are you going to do? I want you to plan or pre-think out possibilities. If your mom has a lot harder time later on, everybody has a good time of day and a bad time of day with dementia. If your mom's tends to start sundowning, you want to be in and out of wherever you take her much earlier, so that she can be back in her more familiar surrounding. Other things to consider is if taking her out on a trip makes her behavior worse at the facility. I have a rule as a therapist when I work in facilities that my job is never to make it harder for the staff. So as an occupational therapist, when I go in and I'm working with people with dementia in, say, a memory care unit or at home, like I'll use this as an example. I had a patient that I was seeing yesterday. I saw him yesterday, yes. That I saw yesterday. He has severe dementia. Fabulous family. Have been working with them using Skills to Care, which is a model that uses that is a caregiver-based approach to identify triggers and how to communicate with people with dementia. And so I had been working with the grandson for a while, and now I'm working with the patient's daughter. And it was kind of fun and interesting because his grandson has been working with him so long, he trusts his grandson implicitly. But I was trying to see if I could get this patient, they mentioned that sometimes in the kitchen, when they take him to the to the kitchen for meals, and he sits in the kitchen chair, they cannot get him back up out of the chair. So the kitchen chair is right behind the kitchen chair is a sink. And I thought, okay, well, maybe because he pulls to stand, That's his primary method of standing up, is he pulls to stand using his care providers. And then I was going to see if we could get him to pull to stand with the sink. And I will tell you, it took me 6 or 7 minutes of being very slow, giving him time to respond, to stand up, to see if he, and no go. And I decided to stop my intervention, which is trying to teach the family to stand him up, because I did not want to agitate him, because I was starting to sense he was getting agitated, right? So back to my previous comment, Miss Cheryl, if you taking mom out on a day trip, and you take her back, and then she's wild and woolly and off the chain and agitated and exit seeking, etc., you need to weigh the pros and the cons of taking her out. So those are some things to consider. I'm not saying don't take her out. I just by experience know that I want a few things I've learned in healthcare. Never take off a CNA. They are your best friend in a facility. They are the ones that are taking care of your family member, so you don't want to make their jobs harder. I want your mom to have the best quality of life that she can have, and so you want to keep all of these things in mind. If she's doing well enough that for right now you can take her in and out, I would probably, based on our conversation, I would probably recommend, Cheryl, that you leave her at the facility for at least a month before you take her on day trips. Let her get used to being there. And so definitely I'm not saying don't do it. I'm definitely not saying do it either. It's one of those things, dementia is a lot of trial and error. And so what a lot of people don't necessarily think about is, just because something worked now doesn't mean that the same thing is going to work next time, or that you shouldn't try it again in the future. You have to try things. You literally have to make think about dementia as having a bag of tricks, right? So you try one thing, you throw it in your bag of tricks. You try something else, it works, you throw it in your bag of tricks. You pull something out, it didn't work today, you throw it back in and you try something else and see if it works. That's dementia in a nutshell. Dementia really is just learning lots of different little strategies that you can throw into a bag, and you pull out and you try one thing, try something else, see if it works, see if it doesn't. So I hope that was helpful, Cheryl. Does anybody else who is on here right now have a particular question for me? We have about 10 more minutes. It's been a very quiet group this morning. I am so super happy you guys are here. I love answering questions. You know, that's my fly by the seat of my pants. And so let's see. I have another question here that I'm going to answer. There's a comment. Let me look at my comments. Very helpful. Great. Thanks, Cheryl. I'm so glad you were here. And thank you for inviting people to the group. I really appreciate it. And for anybody else out there, I do have another group. It's called Think Different Dementia. I'm thinking about actually changing the name, but for right now it's still Think Different Dementia. And I do a second hour-long program there on a Thursday evening where I take topics and I just expound on them. And I hope they're helpful. So the next question we have, and unless anybody else has a question out there, is from Lisa Burke. So I'm Lisa, is what she says. Hi, Lisa. I'm Lizette, and we are in the very beginning pre-diagnosis stage of this health issue. Could you tell me where I could find the best legal information about POA, best course of action, best practices for getting a sitter, etc. for while I'm out? So Lisa, great question. Thank you so much. And I'm so sorry that you're at the beginning of this phase, you know, the suspecting things are going on phase. I'm kind of there in my same... I'm there in my life with my dad, so I totally understand. It is very, very difficult. So let's just talk about, and I'm really super, super glad, Lisa, you're making the right decision here. You have to get the very first thing that you need to do. Anybody who is actually anybody needs a power of attorney for decisions, and you need a healthcare power of attorney. The moment you turn 21 on, you look, actually when you turn to be an adult, you need a power of attorney and a power of attorney for healthcare decisions. Anybody can die at any time. 21 years old, you can go out and be in a car accident, have a head injury, and then not have anybody who is able to make your decision. However, having said that, I know most people don't, but everybody needs to have a power of attorney. So Lisa, how to go about that? The very first thing I want to say is you need to take it seriously, and you need to do it quickly. I would recommend a elder care attorney. And the reason I say an elder care attorney, and I know there are lots of places that you could, there are some lower cost options that are available. One option for a lower cost option is getting trying to get like home health involved, getting the home health agency with a social worker. Social workers can help you set up a durable power of attorney and a healthcare power of attorney, and tell you what to do step by step, right? So that's one way to do it. A second way to do it, and this is my preferred way because I think this is money well spent. Law and legal stuff, honestly, an attorney is the best thing to do. And an elder care attorney, somebody who specializes in elder care, would be my recommendation. And then, Lisa, the other thing that I would do is that I would talk to the elder care attorney, and I don't know anything specific about you, but this is a general program. But what I would tell you to do is talk to the elder care attorney about Medicaid planning, right? Dementia is a very expensive, long journey for people, for the most part, right? Some people find out they have dementia and it's pretty quick and it's over and done with. But for the most part, dementia is a long journey, Lisa. So what I would do, and this is why I recommend an elder care attorney, go to an elder care attorney, get the power of attorney and the healthcare power of attorney set up. Depending on what a person decides, you may need a living will. So those are all the legal type things. And then talk to the elder care attorney about Medicaid planning. Now, what is Medicaid planning? And I can only speak to the state of South Carolina, right, because this is where I live. Medicaid planning means that the attorney will look at the person and all their assets, etc. Like, for example, we did this with my parents, and I was stupid, and we should have done this about 5 years ago. In every state it's different, but in most states, Medicaid has a 5-day, I wish it were 5-day, a 5-year look-back period. So Medicaid can look back 5 years and see what assets a person has. And assets could be house, car, money in the bank, things like 401ks, etc., right? Your assets, whatever you have. So if you go to an elder care attorney and you talk to them about Medicaid planning, and this is what we did with my own parents, because they are asset rich, cash poor, right? So they own real estate, but they don't have a lot of money coming in monthly. On a monthly income basis, they would qualify for Medicaid. So what we did was we did asset planning with the Medicaid, with a Medicaid attorney, with an elder care attorney. So by doing that, you protect the assets, and because it's a 5-year look-back period, you need to do it as soon as you can, especially if the person has some assets. And just because people have assets doesn't mean that you shouldn't qualify for Medicaid for purposes of dementia, because dementia is a very expensive process and a very expensive thing. And so that is what I would do, Lisa, where you said, what's the best legal information? Go to an elder care attorney. Look at asset planning using an elder care attorney and Medicaid planning. And then your second question was best practices for getting a sitter while you're out. So getting a sitter while you're out, what I would do is I would go and look on I would look for a non-medical home health company, and you can find them by just Google searching your area. And then I would try to call a couple, and I would try to call a few and say I'm looking for a sitter, but in order for me to make a decision, I would like to speak to a couple of people who you are providing services to, kind of like a testimonial, like a reference. So that is what I would try to do, Lisa. And so I would welcome one last question from the group. It's been a very quiet group this week, but I am super glad to be here. Does anybody on here live have a particular question? We have about 6 more minutes. This is the Baffled Brain Demystifying Dementia, and I welcome you guys here. This is my weekly hour-long Facebook Live that will teach you everything you need to know about dementia and what to do next. And so I believe that we believe everybody deserves reliable dementia education, and so that's what my goal is behind this. Dementia is complex, but let's make it simple. So does anybody have a question for me out there? I'm going to wait a couple seconds, or just keep going on. I will keep going on because we only have 5 minutes, but if anybody has a last question, I will answer it. So here is a question that I pulled off this morning from Martinez. Now, I don't know if Martinez, I don't know much about them because they're fairly new to the group. So I've been taking, this is what they said, I've been taking care of Dad for 1.5 years. He's done great, but I'm burning out and getting sick. We're looking to place him now, not because of his behavior, but because I'm stressed and tired. It is breaking my heart because I know I will miss him deeply. I always knew it might come to this, but I wanted it to last longer. He doesn't want to go to a care home. He doesn't understand. I know he's done better because I'm here for him every day, and he will go downhill in a home, but my life and health have gone kaput. I cry every day. How do I rise above the sadness and the guilt that I feel for placing him? So Martinez, the first thing I wanted to say is thank you for posting in this group. We are here for you. I know that you've had a lot of people reach out and comment on this, so I'm super glad people are supporting you. And I know it has been a long journey. 1.5 years is a long time, and it's very easy to burn out. And we see this all the time in what we do. So let's talk about that again a little bit. Looks like today's program really has been about transitioning care. And so, Martinez, I'm going to invite you as well to Think Different Dementia, my Facebook group. I did an hour-long program on this particular question this past week. But to just address a couple of things that I wanted to say is just because somebody is placed in a facility does not necessarily mean that they will go downhill. Don't just assume that a facility will placing somebody in a facility automatically causes a downhill decline. That is not necessarily true. I have seen people thrive in a facility, whether it be a memory care facility, whether it be an assisted living or a skilled nursing facility. There are a lot of factors that go into whether or not somebody is going to decline, and some of those factors have to do with what phase of their journey in dementia they are in. So don't just make an automatic assumption that your dad is going to decline. There is a lot that you can do to help him thrive and survive in a facility. And you did not particularly mention what type of facility, so I would encourage you to go to the type of facility that is the lowest, the lowest level of care. And what I mean by that is typically something like, in the case of a person with dementia, if you can go to an assisted living memory care for dementia, that is the lowest level of care that person would be at. A skilled nursing facility provides the highest level of care, right? So if you can, and the reason I say a memory care assisted living is because those people specialize, truly specialize with people with dementia. And And so when you are looking at transitioning your dad from home, if you can get him to a memory care facility as opposed to a skilled nursing facility, and I know there are a lot of factors that play into that, that would be my first recommendation, other than going and watching the program on transitioning care. Now, regarding what you mentioned here in your question, Martinez, about your life and health going kaput. You cry every day. How do you rise above the sadness for placing him? So the first thing I want to say is that you really need to have you need to look and see whether or not you actually have clinical depression right now. People who caregive are more likely, or 50% more likely, to have depression themselves. There is a screening tool that the physicians can use to see whether or not you actually have clinical depression. And just because somebody, and I'm not just my background and training is as a therapist, I'm not pro medication for depression, and I'm not against medication for depression. I feel medication for depression plays a role. I don't think that it always needs to be the first line of defense. So I'm just, saying that from my worldview. But when people have a true clinical reason, like it sounds like you have, a course of medication, and it can take up to 2 years to go through a course of medication for depression to see to have it actually help and then be able to come back off of medication. I'm not a proponent that you go on depression medication and stay on it for the rest of your life. I believe all medication plays a role, and I believe that medication needs to be limited. We need to use it, but we need to limit it too, because every single medicine has a side effect. And so just because you go on a medication doesn't mean that you shouldn't consider going off of it appropriately with the help of your physician. So Martinez, what I would say, please have yourself checked out for depression. And I don't think that it's something that you should ignore, because caregiving is very hard. And yes, when you get to that point, like we talked about earlier in the program, household first, caregiver second, and then the person with dementia, you are doing the right thing when you get to the point that you feel like you're burning out, that you need to have your dad be considered going somewhere else. So I'm very proud of you, Martinez, for making this decision. It is a very difficult decision to make, and I'm very grateful that you have the wisdom to make this decision for your dad. Don't feel guilty. Go watch the program in Think Different Dementia. We talked about that as well. So today is June the 19th, and it is 9 o'clock. So thank you for coming. There are 3 primary ways you can reach me. Message me, Lizette Cloete OT. You can subscribe to my YouTube channel called Think Different Dementia. And then the third way, which is my primary way of helping you, is join my Facebook group called Think Different Dementia, and come watch the other program and ask questions. I am here for you. This was the Baffled Brain, Demystifying Dementia, the weekly hour-long Facebook Live that will teach you everything you need to know about dementia and what to do next. Today is June the 19th, and this was episode 29, and I am your host, Lizette Cloete from Think Different Dementia, where we believe everyone deserves reliable dementia education. Dementia is complex, but let's make it simple. Thank you so much. I end all of my programs this way. May the Lord bless you and keep you, and I will be back again next Saturday. Bye.